I want to thank everybody for coming out here today. My name is Kirk Ray. I'm the CEO of McLaren Greater Lansing here. It's kind of funny. I'm looking out here at the spacing. I feel like I'm at the White House Rose Lawn doing a press event. At any rate, this has been a long time coming. Almost 2 years ago, we broke ground on the hospital, which you see going up behind us. And we broke ground on this a few months back. It's been a little bit in terms of unprecedented times where we haven't had the opportunity to do things like this and host public events. And I'm so happy to see people not through a Zoom camera or a webinar and have to do it in that type of capacity. So I'm really excited for today. I want to take a moment here to first recognize some of our elected officials here with us. We have the Mayor, Andy Shore. State Representative Angela Whitwer. And from U.S. Senator Gary Peters' office, we have Nicole Williams representing. Thank you all for being here. I do want to recognize Jim Barrett, our former board chair, who was instrumental in putting this all together. He's here with us today as well. So let's go ahead and get started. I'm typically one of those that will just kind of operate off script. Today I'm probably going to bore you a little more than I typically would because there's so many things that are going to be happening with this next element of the campus that I don't want to miss in capturing all of those things that are going to be happening over the next few years. So the steel and walls that you see behind me today are soon to be home to the future of the healthcare of our region. Today we celebrate the tremendous progress and countless hours of planning and work that has gone into realizing the dream of our state-of-the-art medical services building and cancer center. I'm thrilled to announce McLaren Health Care is investing an additional $150 million into this project. When we announced this campus a couple years ago, it was $450 million. This takes it to over $600 million, further adding to what is McLaren Health Care's largest investment in their history. What's going to happen with this $150 million? We're going to be adding 2 shells to the hospital floor for future expansion. We're going to increase the size of the cancer center, which you'll hear more about here in a minute, to allow for integration of the Karmanos Cancer Institute and MSU to work side by side. We'll increase the size of our patient rooms to support multidisciplinary approaches to patient care. We're adding a dedicated oncology urgent care for immunocompromised patients. We're adding flexible spaces that allow patients receiving cancer care to have choice between privacy or a community setting while receiving treatments. This investment will help bring about a new frontier in research and clinical trials with integrated oncology care with Karmanos Cancer Institute and Michigan State University. I will jump off script here for a minute, something that's close to me. This past March, I lost my mom to cancer. And I wish you would have had something that you will see that's going to be happening in this new facility for her to be cared for in. It's something I'm proud of as we've gone through the design process and we've talked to physicians and staff about the elements that are going to be built into this and the ability to be able to provide more compassionate care for patients. I wish my mom would have had something like that. Our cancer center will be a place of hope, healing, and innovation. Since this project was announced more than 3 years ago, we've been working with our staff and community to shape the future healthcare campus. Our new medical services building will be home to advanced ambulatory care, including endoscopy services, a comprehensive heart and vascular center with direct cath lab access, and expanded training spaces for graduate medical education, and advanced simulation labs, as well as expanded spaces for our resident physicians. If you can imagine the design that's gone into this, this is going to be an incredible recruiting tool for residents all over the United States of America. This is going to be a destination point for residents that want to come learn in an environment that's going to be innovative and incredible in terms of the aesthetics they're going to be able to operate within. The entire campus was designed from the ground up with the input of our physicians, staff, and community. The feedback we've received at every step of the process has shaped these facilities into what you see today. These spaces will further help our multidisciplinary approach to patient care, bringing teams of physicians together in a single space to share their expertise and bring the best outcomes for everyone who needs us. Around 2,500 construction jobs are being created as part of this project. Think about that for a minute in the environment that we're operating in. I want to recognize the amazing progress Granger Construction and all of the talented skilled trades workers have made on the Medical Services Building and Cancer Center. Please join me in recognizing Granger. Joins out there. Our healthcare campus will be home to more than 1,000 physicians, researchers, educators, and members of the academic and medical team when we see our first patients in early 2022. At this time, I'd like to take the opportunity to introduce our next speaker, the esteemed Dr. Justin Karmanos, who is the president of Karmanos Cancer Hospital and Network. Dr. Karmanos, come on up.
Well, good morning, everyone, and congratulations to everyone who is here. Can you hear us okay in the back? I know we're distanced appropriately. I want to thank you all for being here and for celebrating the next phase of cancer innovation, medicine, and care delivery here in this community. This is indeed an honor for us at Karmanos to be a part of. We are the state's largest provider of cancer care, research, and clinical programs in the state of Michigan. We have 15 locations throughout the state, and our program here in Lansing, this is always unfortunate, but it's very necessary when we need these services, as Kirk indicated with his own personal story of his mother's journey. It's so necessary to have cancer care close to home. And we're seeing in the Lansing community perhaps one of the greatest needs and growth in services in cancer throughout our state here within the Lansing community. Our faculty, our staff at McLaren Greater Lansing and at Michigan State University are exceptional physicians who are incredibly compassionate. They bring with them a team of resources that understand the patient, the needs of the community, and in every case are dedicated to the best possible outcomes for the patients. Those of you who are familiar with our humble campus, just a little ways from here, understand really the opportunity that is before us to have a state-of-the-art facility to be able to offer first of technology radiation therapy services in this new facility behind us, to partner with our academic physicians in Detroit and at Michigan State to offer cutting-edge therapies that weren't available in the community before. At the Karmanos Cancer Institute in Detroit, we are one of 2 NCI-designated comprehensive cancer centers in the state of Michigan, us and that other university to our west. We are very proud of that work. At any one time, we have some 450 clinical trials open to patients. Of the new therapies that are approved in infusional therapies alone, we touch nearly 50% of all new drugs that are approved in the United States for treatment of patients with cancer. And at Karmanos, we usually offer those to patients up to a year before they are commercially available and approved through the FDA. Our view at Karmanos has always been that care must be close to home, that for us to truly impact all of the communities throughout the state, we have to access and make available that cutting-edge therapy wherever patients live. That's truly our mission. I think that is incredibly well aligned with the mission of Michigan State University, both at the Colleges of Human Medicine and the College of Osteopathic Medicine. I'm a CHM alum a few years ago and thrilled to see the opportunities for partnerships that are not only underway today, but the future opportunities that we have to grow and expand together to take care of more patients throughout this state. Thank you for joining us on embarking on this important step to commemorate the facility, to reflect on the importance of it in its community, and as Kirk said, for us to all remember the personal impact of cancer on our communities and our families. We have to make a difference in this disease, and it's through facilities like this and partnerships like this that we have the opportunity to do that. We thank you for your support.
Two most commonly heard lines in 2020. Am I still on mute? And damn, I forgot my mask. So at this time, I go back a couple of years ago when I came to the community and I had dinner for the first time with Dr. Beauchamp, and we were sitting over at the stateroom, and it was kind of like these two strategic thinkers having these thoughts up here like, boy, look at all the stuff we could do together, and what would happen if we could do this? And it was just, I think we went for 2.5 hours, 3 hours just talking about what it could be like if we put our heads together and really started to make a difference. And it's not about the bricks and mortar here. It is today, but it's about everything collaboratively that we've been working on over the last 2.5 years that are really going to make a difference and an impact inside the walls of the organization. So at this time, I'd like to introduce Dr. Norm Beauchamp, who's the Executive Vice President for Health Sciences at Michigan State University. Come on up, Norm.
Yeah, thank you so much, Kurt. Thank you, Justin. I remember our dinner really well, and as I reflected on it, I shared with Kirk that I grew up in St. John's, not far from here, and I went to Michigan State undergrad med school, and I remember saying, one day I want to come back and help a community that did so much for me and for my family. And between that time, and Kirk shared a story, my mom also got cancer. Not cancer, but my mother got cancer. And she wasn't able to get the care that she needed in this community. And she had to travel to get the best in world care, and that will no longer be the case. The people of Lansing will be able to get the very best care they need while they're surrounded by the people that they depend on and that support them. And so for me, this is such an important moment. There's an aphorism I like very much that goes like this. It's, for they who have health have hope, and for they who have hope have everything. I think for too many people, they don't have access to that, and they don't have access to it in a way that, again, they have the support that they need and they deserve. When I came back, I will say in my wildest dreams, it was 4 years ago, I never envisioned all of this, right? This is so absolutely extraordinary, and it builds on a long relationship that MSU has had with McLaren. Our teaching efforts together have been extraordinary. Our clinical work, side by side with nursing, osteomed, human med, terrific. But this now brings it all together. Excellence in clinical care, education, and research. And so I'm so thankful to you, Kirk, and to McLaren for making this possible with MSU. Similarly, Karmanos. One of the things that we sought to build on Michigan State was to bring human health researchers back. So we reached out to Stanford and Hopkins and Harvard, University of Washington. And we talked about, we want you to come back here and be a part of transforming health, of finding the very best ways to care for people. And they said, well, we get MSU does $700 million a year in research. It's terrific. Tell me about who your health partners are and what that relationship looks like. And I can tell you, when we could describe what we're doing with McLaren, but then talk about Karmanos, which is the leading cancer delivery organization in the state, they said, okay, we'll come. And so we filled 2 buildings now on our campus with some of the best researchers in the world. They're here, and we'll be working side by side in ways that really matter. Another goal for us is to recruit the best nursing students, the best medical students, We have two MSU grads here, as you heard, as an example. But by having this type of facility, MSU historically has had maybe a challenge that we couldn't show how we linked as fully as we would like to a health system partner. And again, this is an instantiation of that. And so this will help us recruit the best students, and it will help us retain them as residents and fellows, and join our community to provide the very, very best care. So this really marks something that will echo for generations to come. We couldn't be more excited or thankful to be a part of it. And it's so consistent with, our land grant mission, right? Which is to make sure that the communities in which we are in, we're doing all we can to serve those people. So thank you. Congratulations. So glad to be a part of it.
Can everybody hear me now? So if you see these two large concrete bunkers that are right over here surrounded by yellow insulation, those are called vaults for linear accelerators, which will house some incredible technology for radiation oncology. And a lot of the design that went into the cancer center was really our physicians and our clinical staff guiding us. You don't want a CEO designing clinical space, right? And so we had a lot of input from some really talented physicians. And one of those physicians we have with us today from Karmanos Cancer Institute is our radiation oncologist, Dr. Amit Bhatt.
Thank you. First, I'd like to take this time to thank Kirk, Dr. Karmanos, and Dr. Beauchamp for inviting me to be a part of this very special day. As a radiation oncologist, I have the opportunity to work with medical oncologists and surgeons to guide our patients through their cancer care. I came here 3 years ago to lead a great department and to integrate it within the vibrant cultures that exist within the area. Both the academic culture of Karmanos and Michigan State University and the cultures within the community that you have built this hospital to serve. For me, this cancer center represents this spirit of integration and collaboration in both its design and purpose. From its conception, the hospital leaders have reached out to both top architects and local physicians to ensure that all facets of oncology care can be delivered to their highest level in a patient-centered way. The clinic's location and design will increase our oncology physicians' ability to collaborate locally with Michigan State University and the vast Karmanos network. We can expand the access to more than 800 clinical trials available through Karmanos and the university. We will be able to increase our impact on both translational and clinical research to ensure that not only are the most advanced treatments being offered to the community, but they are being developed within the community. The physical layout of the Cancer Center allows for multi-specialty spaces. Spaces specifically designed with this collaboration in mind. Within these flexible spaces, we can bring together our oncology specialist surgeons, our gynecologists, breast surgeons, and thoracic surgeons. These are spaces where all our caregivers, from social workers to physicians, to get together to ensure that each patient receives the individual care, that the resources they need for the treatment of their cancer. Our oncology navigators will be able to guide our patients to these resources that they're essential for. They will support the heart and souls of our patients through programs such as massage therapy, music therapy, and nutritional and financial support. These spaces will also include advanced telemedicine ability to facilitate communication with experts within the Karmanos network and the state. Through these integrated spaces, we reaffirm our commitment not only to the allopathic vision of medicine, but the osteopathic vision, which is central to the education of our resident physicians in the training programs within the hospital and the university. As physicians within the Breslin Cancer Center and the Karmanos system, we are truly honored by the opportunity to make this a centerpiece in what we believe is a great collaboration that will bring the best experience and the most advanced treatments to the community. Thank you.
And finally, we have to bless the site, don't we? I'd like to invite up here our Director of Chaplain Services and Pastoral Care, Mr. Phil Apol.
Good morning. Well, I must say that when I was asked and invited to offer a blessing today, I was surprised because McLaren is not a faith-based system, but I was pleasantly surprised because asking for a blessing is an acknowledgement that what we're doing here involves more than just us. You know, the buildings will stand on their own, but we need help. We need extra power. We need extra resources beyond our own. That's what a blessing implies, and that the care that's going to take place in this place involves at its heart something spiritual. So I am happy to participate in this and to be here. And in every great world religion, blessings work by our participation in them. To receive a blessing, you have to participate in it. So as I offer this, I want to invite you to participate, either by offering the blessing with me or by receiving the blessing, just with these simple physical movements. And you know, we need to do both. We need to offer the blessing and we need to receive it. So would you join me? May the healing power of Almighty God flow to us and through us to everyone who will come for hope and healing to this place. We are blessed to participate in this work, but we are all imperfect and wounded healers. So take our gifts and skills, Almighty God, which we dedicate here today. Use and transform them in your perfect work of making people whole, of making people well, and include each one of us in that work. Inshallah, amen.
He's much taller than I am. Thank you, Chaplain. So we'll wrap this up. I was talking to Dr. Beauchamp right before this, and I said, you know what's exciting about this? This is the part of the project that's kind of the gateway. These services, our heart and vascular, our cancer services, our endoscopy, all of our physician practices and residencies that will reside in this building, the one that we're blessing today, are the gateway to what's going to be happening in the hospital right behind us. And over the last 2.5 years, in addition to the next 1.5 years when we move into these facilities, that's where all the real human work has been done. Refining our processes, refining the way that we approach and incorporate best practices into everything that we do every day. We still have a lot of work to do, because I've jokingly said we're not going to take crappy processes and people and move them into a brand new building and expect that we're going to be the best at the best. It's up to everybody that's behind those doors that's doing that work every day, our nursing staff, our support staff, our clinical clinicians, our physicians, those that are in imaging services. Everybody that supports the care of a patient is what's most important. The investment that McLaren's making here on this campus in Lansing and East Lansing is the biggest they've ever made. Think about that for a minute. And I don't know that there's a bigger investment right now in mid-Michigan than $600 million. And there's a lot of pressure that goes with that. It means, are we doing the right thing? Are we doing the best to take care of our patients so that when they do come here, they're not going to want to come back because it's a beautiful facility. They're going to want to come back because they received the most compassionate care that they could and the best care that they could. So I want to thank everybody for coming out today. It was great to do something social, even though we get to do it in masks and separated. I can't thank you all enough for your support and for McLaren's investment here in Lansing and for everybody that's doing the work behind the scenes. Thank you all, and thank you for coming out and bless this site. Appreciate you being here.